How much you should sleep in a day? 8 hours. How many say 8 hours we should sleep in the day? Raise your hands. Six to eight, some say. I say 7 to 8. Anybody for 7 to 8? Okay. Now I ask you one more question. How many say that we should sleep for 7 to 8 hours in the night? So, should we sleep in the day? So actually it is night sleep which is more important. And one secret I will tell you, that in my class cheating is allowed. Even in the Western countries, cheating is never banned. Like you can open the books to treat the patient, you can open the books and answer in the exams. You are not supposed to memorize everything in your brain and start vomiting in the exam. No. You should understand. So my teaching is also on the same pattern. Everything is on the screen. So now can you answer my question? At what age atherosclerosis starts? So it starts in the first few years of life itself, and how fast it will progress will depend on our lifestyle, our hereditary risk factors and so many other factors. Okay. We did a survey in this region and we took out coronary artery piece from those bodies which were brought for post-mortem, and then we saw them under the microscope to see for evidence of coronary artery disease, and none of these bodies died because of heart attack. They had different cause of death. So can you tell me the age at which everybody was having evidence of coronary artery disease in their arteries? There was evidence of atherosclerosis when seen under the microscope in everybody. Can you tell me the lowest age? 18. Anybody wants to make another guess? So we found that at the age of 22, everybody was having evidence of atherosclerosis. Like it had started. I'm not saying that their arteries were blocked, but it had started already. If we compare to Western population, there are many studies which have shown that even at the age of 60 years or 70 years, almost 1/4 of the population, they were not having any evidence of atherosclerosis. 1/4. But in India at 22, 100% had evidence that atherosclerosis is going on in their arteries. So anybody who is below 22 here, I think most of you must be below 22. Anybody above 22? Only few. So don't be alarmed, but you have to be alert. Okay. So now you have to start taking care so that atherosclerosis does not progress. Another thing I want to make clear before I come to the actual topic is that what age should we start taking precautions? Anybody can tell me what age we should start taking precautions? 20? 18? Early life. So everybody agrees with me that we should take precautions from early age. So what is the benefit? Benefit is that if we wait till 40 or 50 years, then by that time atherosclerosis has progressed to such an extent that we may already be affected by the coronary artery disease. And if at the age of 50, if we are affected by coronary artery disease, and if we take the average lifespan of the entire world, so in India lifespan is much less, it is in the 60s only. In Japan it is around 90 years. So if we take the average of the entire world, maybe they are living for 77 or 78 years. So if at the age of 50, if we are affected by coronary disease, then the remaining years, which may otherwise be say 28 years more to live, but after onset of coronary disease, this may be reduced to 16 years only. And if we have a heart attack also at the age of 50, then it is reduced to almost 13-14 years. So we are reducing the lifespan if we wait till the onset of the coronary disease. So we come back to the same fact that it is never too young to start taking. So today after the class, think over that it is the time you should start taking care of your own health. Okay, and that doesn't mean you should come to the hospital and get all your investigations, and no. You just have to determine what risk factors you have, because everybody may be having some risk factors. Some may be lucky, they may not be having any risk factors. So these risk factors may be hereditary or they may be acquired. So we will have a different session in which we will talk only about the risk factor. Maybe in the next event we can go through the risk factors and we can talk about how we can prevent the risk factors. So we should start young. Just identify your risk factors and start taking control of them. No need of any medicine, no need of going to the hospital for elaborate tests. And if you want to find out your own risk factors, we have a website, cardiomergent.com, cardiomergent.live. On that we have a performer also. You can just fill the performer, and from that we can find out whether you are having any risk factors or not. So if you have more risk factors, then you should take more precautions to control them. Otherwise, chances of your getting lifestyle diseases or heart diseases or cancers, obesity, high blood pressure, diabetes, that will slowly keep on piling on, and you may be at a risk of getting those in next maybe 10 years, 15 years, 20 years, because 1 out of 3 persons is going to have heart disease. So nobody is immune. So everybody is at risk of getting these lifestyle diseases. So all of us should take care. How many people they are aware that they should take prevention? Even in the Western population, like here you can see the American figures, 99% of the Americans, they need to take care of their heart health. Most of them, they think that they are not going to get heart disease, and not even half of them are taking precautions. So in India, this is much worse. Like, we never take care of our health, and we think that we should only go to the hospital if we fall ill or we have some complication. We started one global trust called Cardiomergent. I don't know whether you are aware about it. And the purpose of this is that we should make everybody aware about the comprehensive management. And in the future, it's not the job of one person. Like, it's not my role only, like cardiac surgeon, we should do all the surgeries and don't take care of other aspects. We need the help of everybody. We need the help of cardiologists, cardiac surgeons, cardiac anesthetists. We need the help of pulmonologists, nephrologists, endocrinologists, and we need the help of dietitians. We need the help of nurses. We need the help of physiotherapists and psychologists. We need the help of teachers. We need the help of the government. So everybody has their own responsibility in taking care of health. And how we can take care of the health? We should start from primordial prevention. Primordial prevention means that in the early age of life, when you don't have any risk factor, you start taking care of your health. Your parents, they educate you how to take care of health. Your teachers, they educate you. Then we go to the next stage, which is the teenager stage, and then we gradually start acquiring risk factors. Somebody may start smoking, somebody may start taking alcohol, somebody may start having stress, somebody may be obese, somebody may be having some hereditary issues. So at that age, if we identify our risk factor and then we start taking care of them, then we can slow down the progression of the disease. Next stage is early diagnosis. When you start having symptoms, then immediately you contact the expert person who knows how to diagnose your disease, and we may modify your lifestyle. We may tell you to do some physical activity, we may tell you to take some diet control, and then we may control your disease. So here there is a role of physiotherapy, there is a role of dietitians, there is a role of nurses, and there is a role of doctors who, without prescribing medication, they can control your progression of the disease. Next stage is we need medical management, like we may have to give medication to the person, but at the same time this lifestyle control will continue. After that, somebody may even cross that stage and develop complications which require intervention. So we have to, as a team, we have to decide which is the best intervention needed, and then we give the intervention. Somebody may need a stenting, somebody may need a bypass surgery, somebody may need a pacemaker. So depending on what condition they are having, they may need some intervention. But after intervention, does the treatment stop? So what is the next stage? जोर से बताओगे? So sleeping is not allowed in the class. So next stage is rehabilitation. And after a proper rehabilitation will help the person in coming back to the normal work. And after that, what is the next stage? Secondary prevention. Why we do secondary prevention? We have to prevent the person from again becoming a patient. So if we don't prevent that, he will keep on coming to the hospital again and again. So unless we follow all this, we can never give the best treatment to the patient. And can somebody alone give all this? I cannot give this alone. So I need the help of all the specialties here. So all the specialties will help us to deliver this care. So that's why I want that all should participate in this and all should know how to deliver the care. So what are the signs and symptoms of a disease? Suppose we have to find out whether this patient is having a heart disease or not. Are you aware of any signs and symptoms of heart disease or coronary disease? So most common is chest pain. So can you describe the chest pain? Chest pain, typically heart disease chest pain may be, some say on the left side, some say on the shoulder, radiating to arm, sometimes it is radiating to the jaw, and sometimes to the back. So everybody has different symptoms, but as a rule, if anybody is having pain anywhere above the level of the umbilicus, you should keep the first possibility of heart disease. Once you have ruled out heart disease, then only think of other things. But in India, most of the people think if you are having pain in the epigastrium, the left side of the chest, they think digestion is wrong. So they start taking antacids. And most of the heart attacks, patient collapse or they come to the hospital late because they are taking self-medication or medication from unqualified practitioners, or maybe even qualified practitioners may not be able to diagnose that this is a heart problem. So any pain above the level of umbilicus, first rule out heart disease. Next symptom is shortness of breath. So when shortness of breath occurs, when blood supply is not enough, the heart muscle is getting damaged, so the pumping will get affected, your lungs may get congested, and person has shortness of breath. Some people may complain of just palpitation, some people complain of vomiting, nausea, cold sweating, some people, especially women, they don't have typical symptoms. So we'll discuss what kind of symptoms women have and what is the difference between men and women. And some patients, especially diabetic patients or elderly patients or postmenopausal females, they may not have any symptom at all, and they may just come with a heart attack, and already heart attack may have happened silently